Today, we're delving into the exciting realm of regenerative medicine with a focus on mesenchymal stem cell therapy for ankylosing spondylitis at Regenemax. Ankylosing spondylitis is more than just joint pain. It's a chronic inflammatory condition that affects the spine and sacroiliac joints, leading to stiffness and progressive fusion of vertebrae. While there's no cure, MSC therapy offers hope by targeting the underlying immune dysfunction driving the disease. Mesenchymal stem cells are renowned for their ability to modulate the immune system. In AS, where the immune system attacks the joints, MSC therapy can help regulate this response, reducing inflammation and potentially slowing down the progression of joint damage. This could significantly improve the quality of life for AS patients. One of the remarkable advantages of MSC therapy lies in its regenerative potential. AS can cause irreversible damage to joints, but MSCs have the capacity to differentiate into various cell types and release growth factors that promote tissue repair. This regenerative process may restore joint function and mobility, offering new possibilities for AS management. Chronic pain is a major challenge for AS patients, impacting daily life and overall well-being. MSC therapy has shown promise in alleviating pain through its anti-inflammatory effects and tissue repair mechanisms. By reducing inflammation and promoting healing, MSCs could potentially lead to decreased pain levels and improved mobility. Joint stiffness and limited mobility are common in AS. MSC therapy's ability to repair damaged tissues and reduce inflammation may restore joint function, allowing patients to move more freely and engage in activities they enjoy. This could significantly enhance their overall quality of life. While conventional treatments like NSAIDs and DMARDs are standard for managing AS symptoms, they may come with side effects. MSC therapy offers a novel approach that could potentially reduce the long-term use of these medications, minimizing associated risks and improving patient outcomes. Clinical trials have demonstrated that MSC therapy is generally well tolerated with minimal side effects. This suggests it could be a safe and viable treatment option for AS patients who may not tolerate or respond well to traditional therapies. In conclusion, mesenchymal stem cell therapy represents a promising frontier in the management of ankylosing spondylitis. The immunomodulatory, regenerative, and pain-reducing properties of MSCs offer new hope for improving joint function, mobility, and overall quality of life for AS patients. Stay informed about the latest advancements in medical science by subscribing to our channel and visiting Regenemax's website for more information. Together, let's explore the future of healthcare innovation.